Welcome to Maryland Medicine Frontline News. Coming up, how the Department of Family and Community Medicine is using information and technology to improve COVID care in the community. The School of Medicine is in the national spotlight once again for our COVID-fighting vaccine research and clinical care. And this week, research is gradually ramping up after a transition to phase 2 for laboratory-based research. That means laboratories and other research spaces will now be allowed to function at 50% occupancy.
The reason that we felt comfortable moving to phase 2 was because of the wonderful compliance that we've seen during phase 1s and the very, very low rates of any kinds of infections. So we have no evidence of any on-campus transmission between researchers. And this gave us confidence that we could continue on to phase 2 because of the high level of compliance that we've been seeing.
Under the safety guidelines, labs must ensure physical distancing with space of 150 square feet per person. Some labs have installed protective partitions. Before entering the building, all lab personnel must use the Safe on Campus app and confirm their health by taking their temperature and reporting any possible symptoms. Also required are face coverings, hand washing, and disinfecting spaces. At the Institute of Genome Sciences, Dr. David Rasko is looking forward to increasing research output, especially on COVID-related projects.
Here at IGS, we do a lot of things in silico or on our computers, and so we've been able to be fairly productive even though we haven't been able to be physically in the lab. But now as we've opened up through phase 0 and phase 1 and now into phase 2, we can get more people in so we can generate much more data on the projects that have been somewhat halted in the lab. What we have been doing within the lab is spreading people out, trying to have different shifts with people, as well as minimizing people's time physically on campus. So they come in, they do what we need to do, and then people go home.
It's expected that phase 2 will continue for the foreseeable future.
Now, we're very happy that we've been able to, in general, manage the virus surge in a way that we can return slowly to near normal activities. And I want to affirm the faculty members and their staff and their postdocs and their students. During this time, while we were on a sort of our close down, our lockdown as it were, clearly there was a lot of research-related activities that actually were going on. Our records actually indicate now that grant submissions just between March and June has increased beyond 50%. That's been extraordinary, which tells me that people have been using that time very effectively, and I'm so very proud of that fact.
The School of Medicine remains in the national spotlight for our COVID-fighting vaccine research and clinical care.
Dr. Neil Reynolds has set up a robotic telehealth program.
Our faculty have appeared on network news broadcasts, including NBC Nightly News and CNN. And this week, Dr. Karen Kotloff appeared on The Today Show.
This morning, another potential coronavirus vaccine is entering late-stage testing. Another key test for these clinical trials, recruiting volunteers from diverse, at-risk populations.
It's affecting more vulnerable people in the population, the elderly, people with underlying diseases, and also certain racial and ethnic groups.
The Department of Family and Community Medicine is using information and technology to improve COVID care in the community. Since the pandemic began, the department has been communicating important infection prevention messages in West Baltimore. The department has also been gathering vital data from patients to provide better COVID care and improve the delivery of primary care.
We wanted to know within their community how much of the virus was there. We wanted to know also about their specific needs that could impact their health, their access to food, their access to transportation. All of those things have direct impact, especially in our population with how their health is.
The department started collecting the data as telemedicine became a pandemic necessity. It quickly became apparent that age, location, and living arrangements were important factors.
We started to realize early on that our 25 to 45-year-old women were our biggest demographic getting the COVID. And very soon, the 45 to 65 followed. We also start to realize that they all live in the same household, which is kind of how they're getting this so much transmission of disease in that same little pocket.
Health disparities in the community have presented many challenges for patients and physicians.
We really understood that patients who live in these areas, also some of them need to go out and get groceries, so they have to be out of the house. Many of them, their telephones, their smartphones don't have capacity. So they cannot talk to you on a video chat. And a lot of these patients didn't have the capability of opening a Zoom call.
Dr. Stewart believes the data will have a profound impact on the care provided by the department in the future.
When this pandemic is over, and we all anticipate it will be over, we want to come out as a more perfected, patient-centered medical home, which has evolved further with technology, which has evolved further with engagement to the community we serve, and be better for that.
You can stay up to date by visiting the coronavirus update page on the School of Medicine website. Until next week, I'm Larry Roberts for the University of Maryland School of Medicine.